This is Mayor Oliver Gilbert, and we've gone virtual. Now, I wanted to make sure that we had the opportunity to learn how to save a life while staying at home. Join me for CPR with Dr. Carrington. Let's learn how to save lives together.
Welcome back to Virtual CPR First Aid Educational Training. We hope you're enjoying the weekly sessions and that you're learning. Let's get to another session. Today's Save a Life technique is using an EpiPen, or otherwise known as epinephrine. An EpiPen is exactly how it sounds. Epi, short for the medication epinephrine, and a pen-like object that holds medication inside that has a needle at either end, just as a writing pen tip. We use EpiPens during severe allergic reactions. You may ask yourself, what does a severe allergic reaction look like? An allergic reaction can occur when a person consumes a food that they are allergic to, a substance that they smell, something that they drink, touch, or otherwise expose themselves to. Even some medications can cause an allergic reaction. During an emergency, when a person is experiencing a severe allergic reaction where you will need to use an EpiPen, this is typically what you would see and what you should do. Sudden weaknesses, instant hives on the skin, severe itching, trouble or rapid breathing, swelling of the tongue and face, signs of shock such as cool, clammy, or pale skin, bluish tinged lips or fingernails, and for darker complexion, it may seem gray, nausea, or even vomiting. Let's take a look at this clip courtesy of EpiPen and American Heart Association on how our bodies respond to allergens.
Your immune system is designed to defend your body against dangerous invaders like bacteria and viruses. But sometimes it overreacts to harmless things like grass, dander, or pollen. When this happens, your body is having an allergic reaction. Things that cause allergic reactions are called allergens and vary from person to person, like bee stings, medications, shellfish, or peanuts. Once your immune system recognizes the allergen, it triggers your white blood cells to release antibodies. That triggers a chain reaction that produces the symptoms of an allergic reaction, like sneezing, wheezing, itchy eyes, or hives. Allergies are very common and usually pretty minor, but sometimes a reaction can be sudden, severe, and potentially life-threatening. This is known as anaphylaxis. For minor reactions, try cool compresses and over-the-counter treatments like antihistamines that come as pills, creams, and eye drops. For more serious cases, your doctor may prescribe allergy shots or tablets, self-injectable epinephrine, or steroids. Allergies may be irritating, but they're nothing to sneeze at.
After seeing any combination of these signs and symptoms, you must react. Here is what you should do. Phone emergency services or call 911. Help to get and use an EpiPen, epinephrine, from the victim's personal belongings or first aid kit if available. Let's take a look at this clip of using an EpiPen courtesy of EpiPen and American Heart Association.
How to use EpiPen on someone else. If your child or someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why EpiPen should be used at the first sign or symptom of a severe allergic reaction. Just follow these 2 simple steps. Grasp the EpiPen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of their outer thigh. Swing and push the orange tip firmly into their mid-outer thigh until you hear a click, and hold on their thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend to cover the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. The extended orange needle cover and black indicator in this window will show you that EpiPen has delivered its epinephrine. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. Anyone receiving an EpiPen injection must seek medical attention immediately. The effects of epinephrine can wear off, or a second reaction could occur. Call 911 or take the individual to an emergency room right after using EpiPen. If symptoms continue or get worse, you can use another EpiPen or EpiPen Junior 5 to 15 minutes after the first dose. Do not inject more than 2 injections right after each other. Remember to bring all the used EpiPen autoinjectors with you to the hospital. Give them to a healthcare professional for inspection and disposal. After getting medical help, stay close to a hospital or where you can easily call 911 for the next 48 hours. If you are the primary caregiver for the individual at risk, remember to ask for a new prescription for multiple EpiPen autoinjectors. Watch this video as many times as you need to learn how to use EpiPen. You can also practice with the EpiPen training device. It's very important to only use your training device when practicing. Never use your real EpiPen to practice on yourself or others. For more information about severe allergies and EpiPen, visit epipen.ca.
Now, if you see a person who appears to be experiencing a severe allergic reaction, you can help. Remember to observe the victim, call 911, find and use the EpiPen, and you too can save a life. Thank you for watching. Remember, everyone can learn to save a life. See you next week for more educational training on first aid and CPR.
I hope you enjoyed today's session and I hope you learned a lot. Join us every Saturday at 10 o'clock a.m. on Facebook Live for CPR with Dr. Carrington. If you want to view this session again, just to brush up on your skills, visit cmgengage.com/virtual. We'll see you next week.